Doctors, 72 group, thank you, 64, 66.
Hello, Professor.
Hello. Hey, don't watch it. It's take only 10 students, but now present 11. Please watch his name. Doctors, we film our lecture, viral hepatitis. Is viral hepatitis. And doctors, tell me please, when you think about this diagnosis viral hepatitis, when you diagnose the diagnosis to your patient, what is basic syndrome? You studied therapeutic course, yes, physiology in the third course of university. And you know, viral hepatitis, what is organ affected? Liver, yes. And what is basic syndrome characterized affected liver?
Cytolytic syndrome.
What is?
Cytolytic syndrome.
Cytolytic syndrome. And doctor said me jaundice. Yes. Jaundice is a syndrome when affected liver, but don't only characterize to parenchymatose if you affected liver. For example, cytolysis of erythrocytes, hemolytic jaundice. This time is affected erythrocytes. It is this disease is not connected with affected liver, and mechanic jaundice, surgical pathology, obstruction of the bile ducts. It's another situation. This syndrome is not characterized only to viral hepatitis. And doctors, from physiology course, liver is very good regeneration organ because it has a good vascularization. And after 24 hours, appear new hepatocyte. This time, damage of hepatocyte. Next day, after 24 hours, appear new hepatocytes. And to developing jaundice must be affected 70-75% of hepatocytes. And you understand regeneration process very good, and you understand who is from all groups of humans have a good regeneration process, who have good vascularization of the liver. What is group have good vascularization and regeneration process? Younger and older? Younger. And you understand younger men and children have good vascularization, good regeneration, and usually prevalent anecteric cause. Because this time hepatocytes affected, next day appear new hepatocytes. But to develop jaundice must be affected 70-75%. Necessary time to affect hepatocytes, but next day appear new hepatocytes. And usually ecteric forms characterized to older persons. And from all viral hepatitis, 30% have ecteric cause, and another 70% have anecteric cause. And you understand, jaundice is not basic syndrome to think about diagnosis viral hepatitis. Jaundice, you think about necessary detect jaundice, will be mistake. And doctors, tell me please, but what is syndrome of viral hepatitis? It is connected with liver function, basic function of the liver. Why necessary for you liver? What do you do liver in our body? Why necessary for you? What is? Yes, detoxification and disturbs sight and appear infection syndrome. It is basic syndrome. And doctors, all viral hepatitis, ecteric cause, unecteric cause, characterized basic syndrome, intoxication. But jaundice maybe appear, maybe don't appear. And you understand present two causes of viral hepatitis, ecteric and unecteric. And doctors, you must discuss 5 distinct viral hepatitis. Parenteral and fecal oral mechanisms viral hepatitis. Fecal oral mechanism viral and E. Parenteral B, C, and delta. But it is only 5 distinct. Registered many viruses of whose affected liver. For example, herpes virus, cytomegalovirus, Epstein-Barr virus from group family herpes viruses, liver, and TTV, F, G. It is new viruses, registered rare but affected liver. You discuss only 5 distinct viruses registered in the worldwide. And actuality of disease. Look, 1 million people die from viral hepatitis worldwide every year. Well, no problem. And result is the cases connected with outcomes of chronic viral hepatitis. Doctors, basic complete of all acute viral hepatitis, it is encephalopathy, acute hepatic encephalopathy. But it is complication rare, but outcome when developing chronization cause, developing outcome hepatocellular carcinoma or cirrhosis. Result cirrhosis is 500,000 every year die, result viral hepatitis B, and 400,000 patients died, result developing hepatocellular carcinoma. And from hepatitis A, B, C, and E, usually actual hepatitis B, because high percent lethal cases connected with viral hepatitis B. Why will be discussed later. And doctors, please, it is actuality of viral hepatitis. And second is it is viral hepatitis C, where 300,000 cases connected when developing cirrhosis after many times, many years persistent virus hepatitis B. And please look what I said you, fecal oral hepatitis A and E, and hepatitis B, C, and delta. This day will be discussed 2 viral hepatitis A and B. And Friday we will be discussed another viral hepatitis. And doctors, viral hepatitis A, fecal organism. Tell me please, who is from all population infected fecal viral hepatitis? Yes, children, because children don't use sanitary measures. And one toy to many children who play in the child garden. Yes, in primary school, and infected for oral hepatitis. And doctors, if fecal oral, you understand, it is disease characterized endemicity, where poor sanitary and first time when ization system bad, when canalization water go to the central water, and will be this semester, autumn semester from September September to December, and we use diseases of intestinal diseases, and we'll discuss colic, shigellosis, salmonellosis, and if patient infected intestinal infection disease, fecal oral mechanism, patient must be now patient has little part of feces. This in the feces present infection and virus it is infection agent in the canalization water system. So, and this canalization water go through the central water, and if patient drank alkaline water infected viral hepatitis, it is actuality to the regions where poor canalization system. And another situation where many rivers, and when you wash it, and together drunk water and infected. And you understand what is regions? So, for example, Russia Federation moderate incidence of viral hepatitis A. And tell me please, where endemic region in the Russia Federation? Where? Russia. Where? So regions and humans washing. See, Black Sea, like Sochi, Crimea. It's usually very good regions and travel regions, but canalization may go to the Black Sea, washing, you drink water and infect. Why? It's acquired as actuality. Last century, it is in this region was only one floor house home, but now building high building, but canalization system goes. The canalization system don't make good water, and water from canalization system go to the Black Sea. And season usually summer, autumn period, will be discussed now. And please, Dr. Slow, definition. What's mean viral hepatitis? Hepatitis A is an acute viral entrepreneurs infectious disease. Entrepreneurs, you understand who is this infection? Only human with fecal oral transmission over time. It is characterized by the development of parenchymal hepatitis, a cyclic, mainly benign cause. Viral hepatitis A characterized good prognosis. Don't develop colonization cause. Virus has only one serotype. Patient infected during life only one time, and don't repeat infected because this virus has only one serotype. And developing post-infection lifelong immunity and rare registered complication, acute hepatic encephalopathy, 0.01%. Absent colonization cause and absent rare registered complication. And with disease characterized good prognosis disease. Copied? I wait.
So for
Yes. Maybe infected a second time immunodeficiency patients, for example, patients, but usually only one time. Yes, another species of viral hepatitis infected, for example, B, C, but viral hepatitis A, patient infected only one time. You'll be discussed shigellosis, salmonellosis. Usually, one patient may be infected many times, but because developing post-infection immunity. Copy? Continue. And etiology. It is RNA. This virus type 2 enterovirus belongs to virus genus of Picornaviridae family and a shell spherical particle with a diameter of about 28 nanometer. But what is necessary for you? RE virus RNA genome consists of about 7,500 nucleotides, and the 7 human genotypes identified, 7 genotypes. But these 7 genotypes have one serotype. Only one serotype. Sorry, I must take photo. How many students present? Right? Copied? And continue. And doctors, to develop an infection process, this dose of the virus hepatitis A virus only to the 10 to the power. But concentration in the feces 10 to the 8 to the 11 power. But to develop an infection process, the activity tighter. Not necessarily a high dose, only a little dose, 10 over 2, 10 to 30 power virus. Yes, to develop an infection process. And virus has high immunogenicity and interferogenicity. And virus is resistant to environmental factors at room temperature for several weeks, and to refrigerator, virus persists for months, and temperature minus 20 for years. Okay? Yes. Where you live, room temperature. And why necessary for you? And if you you keep in the refrigerator, how many times virus persisted? For months. You return from endemic region and buy in this endemic region food, and this fruit in your refrigerator present many weeks. And when you this fruits add without washing, active. For example, usually incubation period lasting 1 month. And our question, how many times ago you was in endemic region? For example, patient said to you 2 months ago. Yes, but if take endemic region fruits and wash and add, maybe perfect. It's information. When you take epidemiological analysis, you don't take information about where patient travel and what is fruits and take from this country, how many time keep in the refrigerator. Yeah. Do you understand me? Okay, continue. And hepatitis A virus resistant to acids and fat solvents. Doctors, acids against acids. You know, in our gastrointestinal tract, stomach, acid medium, but acid medium is don't affect virus hepatitis A because don't affect it. Virus resistant against acids. And storage time in water, food, wastewater, in various environmental objects. Inactivated by boiling during 5 minutes. You must drink in boiling water. It is prevention not only against virus hepatitis A and another diseases. After chlorine, ultraviolet irradiation, and simple chemical disinfectants, and 70% effective virus. This alcohol, 70 high concentration. Usually, alcohol is how many percent? 15, 12%, yes, but 70%. Humans don't may drink a 70% alcohol, ethanol. Copy it? Mm-hmm. And incidence is often manifested as outbreaks or epidemics. But where registered our epidemic? In endemic regions. Because not only poor sanitary measures necessary, and climate. For example, you understand, in the region, the resistant viral hepatitis A only travel in endemic regions because temperature is not good for virus. But tropic, subtropical regions, very good temperature, good replication virus. So region Russia Federation is Black Sea site. And virus hepatitis A virus susceptibility is universal. Most often the disease is recorded in children 3 to 12 years. And endemic regions, persons from 30 years have antibodies against virus hepatitis A because in the childhood had contact. Maybe clinical picture is manifested. Patient had some clinical cause because when diagnosed viral hepatitis, when present jaundice, I said younger men and children really have an ecteric cause, and mother, this child, and doctors don't think about diagnosed viral hepatitis. And but 30 years who live in endemic have antibodies against viral. And the highest incidence rate is recorded in developing countries with unsatisfactory sanitary and hygienic living conditions. But now situation now are century migration, yes, and in Western Europe, human from Southeast Asia migrate to Western Europe, and registered focuses of the disease in Europe. Please look map. Bad situation of viral hepatitis A. It is South America, it is Africa, Southeast Asia, where high incidence of viral hepatitis A and another intestinal infection disease. It is characterized by very good climate. And moderate incidence, it is East Europe and Russian Federation. Both climate and said what is problems. And the bed canalization system too. But Western Europe and America and Canada it is a low incidence and usually connected with travel to endemic regions. Okay? Okay. And hepatitis A virus over the years has variation. Incidence increases every 2 to 5 and 7 to 20 years, which is associated with a change in the immune structure of the population. Yes. And seasonality, understand, in our country and Europe, it is summer water period, times of holiday. But doctors, incubation period lasting 1 month. You traveled in endemic regions in August, but when will be developing clear picture? Only September or first days of October. Because incubation period lasted 45 days, 30 days. In low-income countries with poor conditions and hygienic practices, infection is common, and most children, 90% children affected, have been infected with the hepatitis A virus before the age of 10 years, often without signs. Why? Because regeneration function will be discussed clinical picture. I speak with you. And who is source of infection? Who is reservoir of infection? Men. Ill men. Incubation and a clinical picture of development. The three main categories of sources of infection excrete hepatitis A virus with feces. If fecal oral mechanism, you understand where present virus in the feces. Short time will be in bloodstream, it is incubation, but after we developing clinical picture in the feces. And persons with an asymptomatic or viral hepatitis A, patients with an ecteric form, it is epidemiological hazard because this diagnosis is not diagnosed, not isolated, and have contact healthy persons. And patients with ecteric form, but you then it is third place because it who have ecteric form usually isolated life, don't have contact with person, but humans with ecteric form, asymptomatic form, usually is don't because absent diagnosis have contact with doctors. Please stop talking. Ali, Zain. Please stop talking. Do you understand? Okay, continue. And I said you, to develop a clinical picture must be 10^2 10 power, but concentration viral feces reaches 10^8 power. And you understand, one dose, for example, cup of water, where present from canalization system water, and develop a clinical picture. The highest, the pathogen concentrated feces of the infection cells observed in the last 7-10 days of the incubation period and the first days of the disease from 2 to 14 days, usually 1 week, 5-7 days. In most patients, virus concentration in the feces decreases when jaundice is. Why you continue repeat discuss pathogenesis, but when patient epidemiological hazard and period absent clinical picture, don't know infected virus hepatitis, and persons don't know, and patient contaminated around in place. But what is rules? What is situation? Absent hygienic measures. After WC, patient must be washing, but absent with measures contaminated around in place. And why this is characterized to children? Because children don't use sanitary measures. Copy it? Okay. Hepatitis A virus doesn't pass through the placenta, is not excreted in breast milk. And you understand, pregnant women, when infected viral hepatitis A, keep this pregnancy. And then the virus don't affect a newborn. And in the milk present, in the breast milk present only antibodies, virus absent. When child feeding breast milk, take only antibodies. With antibodies, play prevention role. Short time, but prevent. After this, pass from board. And almost everyone recovers fully from hepatitis A with a lifelong immunity. What I said to you first time, developing lifelong immunity and antibodies lifelong. Antibodies against virus hepatitis A resistant lifelong. And sorry. And hepatitis A virus, fecal, oral, I said to you, and transmission ways, water, usually all epidemic connected with water, because when centrally water present virus, often infected you, but who drinking boiling water don't infect. And food, doctors, what is food? Food, it is food grow on the soil. And what is contaminated? Apple, grass. Grass, because grass in the soil. But apple on the tree, yes, and only put you from soil and don't wash it. You may grass necessary many times. Yes, and doctor, it is what's food? Berry, strawberry, rice. You take boiling. Yes, you don't free eating. Maybe, and it is food. Usually, for example, focus of this. For example, members of the family infected. What is food character and contact household. One member of the family infected and who have care with ill person, maybe infected. When absent hygienic measures, where humans use hygienic measures, don't infect. It is contact household. And rare cases, extremely rare, sexual transmission, but within humans who have like group MSM, men likes with men. And it is with oral anal contact. And doctors, I said you, in Europe, usually now registered focuses of disease after parent of homosexual. For example, in Germany, and our persons from the Federation who had traveled in Germany with parent and infected and hospitalized in our clinic. It is this group, and maybe parental. Why? Because by in the blood in the part of infection incubation period. Will be discussed pathogenesis in short time. Virus will be in the bloodstream with time absent clinical picture, and donor may be source of infection recipient. And blood transfusion from donor for the incubation period of the disease. Because in the transfusion station, usually blood examinated to parenteroviral infections, but don't examinated to fecal oral mechanisms viral. This time, human is incubation period, virus present, but absent clinical change in the blood. And registered disease, viral hepatitis A of the drug addict person group. For example, in the Norwegia, Scandinavia countries, registered viral hepatitis after using narcotics. Why? Because narcotics come to this Europe countries from Afghanistan. But who is a container to this narcotics? Narco-courier. Who is narco-courier? Human. But where this narcotics? In the lichen test. If this time this courier infected and this drugs contaminated and registered, for example, 20 years ago, 30 years ago, for viral hepatitis A from a drug addict person from Scandinavian country, because it is drug was contaminated. It's rare cases, but in the literature you may detect it, as well as of intravenous administration of contaminated drugs. In period from 2 weeks to 6 weeks, 1 month usually. Okay, it is full information about biology. No? Do you understand? Okay, doctors, basic mechanism, fecal oral. Rare cases, injection, result transfusion, and rare cases, it is sexual oral contact and drug persons. It's rare cases, but basic fecal oral and connected with travel to endemic regions. And now pathogenesis. Viral hepatitis A, lymphotropic, where patient drink contaminated water and eat contaminated food, vegetables or fruits. One part of the virus presented to lymphatic tissue of the oral cavity, what is lymphogenal ring, and repeat in this lymphatic tissue. And the valent part of virus hepatitis A with food and water pass to the stomach. But in the stomach, acid medium is don't affected virus. And the virus coming and virus to the small intestine. In the small intestine, alkaline medium. And in the small intestine, lymphatic tissue. You know, distal part of small intestine, reach of lymphatic. You know what is sanitary follicles, pear, and appendix, where present lymphatic tissue. In this lymphatic tissue, virus replicated. It is Okay. Will be time to me. Waiting. Continue. And doctors, this time from time of when patient add the products and replicate virus in the lymphatic tissue incubation period. After, virus from lymphatic barrier go to the bloodstream, and this time will be short time viremia. It is continue incubation because aim of virus what is hepatocytes, and virus reaches the liver through the portal via system, and virus introduction in the hepatocytes and replicated in this cytoplasm of the hepatocytes, in the cytoplasm. You know, replicated in the cytoplasm or in plant. Replicated in the cytoplasm. Liver cell necessary for virus. Virus is don't himself affected liver cell. Developing in direct cytolysis of hepatocytes. Immune system take information or another anti-hepatocyte and affected, and together affected hepatocyte were city virus. But doctors, when virus replicated in hepatocyte, one part of the virus with bile go to the intestine, and this time developing what is bacteria virus in the feces, and this time you detected virus in the feces, this time human source of infection without clinical picture. This incubation period, because before developing cytolysis of hepatocyte, absent clinical picture. Why developing clinical picture? Virus, immune system affected virus together affected hepatocyte. Disturbs function of hepatocyte and appear what is syndrome, you say intoxication syndrome. When affected 75% later, and it is developing jaundice. And doctors, you understand, first time appear intoxication syndrome, and later appear jaundice. These two syndromes don't appear together. It's necessary time to affected 75%. You understand me? And it is specific characteristic for all acute viral hepatitis of all etiology. Cyclic cause, anecteric cause, pre-ecteric period, and after ecteric period. Pre-ecteric period before jaundice. When appear jaundice, ecteric period. And doctors, but when virus replicated in hepatocytes, virus with bypass to the small intestine and feces leave body. And this time, human is source of infection. The activated what is fecal oral mechanism. And doctors, sorry. But when this look, what is realization? Cytotoxic lymphocyte and natural killer affected virus, but virus in the cytoplasm and together affected hepatocyte, developing cytolysis of hepatocyte and disturbs wall of the hepatocyte. You know, if affected hepatocytes, what you detected in the biochemical test? Yes, very good. But ILD in the cytoplasm, IST in wall of hepatocyte. And usually ILT level will be higher than IST level. because all cytoplasm go to the bloodstream. This cell immune response together activated B cells, B lymphocytes. It is overall immune response. What do B lymphocytes? Synthesis antibody. Antibodies connected antigen and developing antibody active cytohepatitis. Antibody-dependent cytolysis, cell cytolysis, ADC, antibody-dependent cell cytolysis. And all hepatocytes were present, virus affected. Doctors understand concentration virus in the small intestine drop, decrease, because all viruses affected, but appear clinical picture. If affected hepatocyte, first time appear intoxication syndrome. When you detected jaundice, understand how many percent hepatocytes affected? 70-75 total, and concentration virus drop, decrease. And jaundice, usually patient is not source of infection, maybe low concentration, but prevalent absent virus this time. It is connected with pathogenesis. But when patients come to you, when appear jaundice, before appear jaundice, patient has on asthenization. Patient waited, tomorrow will be my condition. Tomorrow my condition will be good. And continue walking, continue studying. Patient condition satisfactory, but patient walking. But when appear jaundice, it's don't know, yes? And go to the doctor, patient isolated, hospitalized, but this time it is not source of infection. Patient was source of infection before appear jaundice. You understand me? Mm-hmm. And doctors, please remember, virus himself is not hepatocyte, developing indirect cytosis, indirect from cytotoxic lymphocytes and natural killers. And this, are you copied scheme of pathogenesis? And pathogenesis of viral hepatitis A. Implementation of specific antiviral immunity. Immune-mediated cytolysis of hepatocyte-infected virus. I said you, virus is not himself affected. Absent direct cytolysis, indirect. And antibody-dependent cytotoxicity, it is humoral response. And virus hepatitis A eliminated from the body. And when developing jaundice, you understand, concentration virus drop, and after will be human body suddenly will be developing recovery. Patient is not characterized, and 0.01% developing outcome, complication, encephalopathy, acute hepatic. Usually good prognosis. Copy? Have you questions about pathogenesis? Usually very good prognostic disease, developing colonization course. And clinical picture. Doctors, clinical picture connected. What is forms? You know, ecteric form, anecteric form, and 10-12% registered ecteric, and 90-80% ecteric form. And developing a clinical cause and apparent cause. Yes. And no, don't develop in cataracts. And severity, it is common for all diseases, mild, moderate, severe. And incubation now lasting usually 1 year, and after the pre-ecteric period, before developing jaundice. And doctors, what is various pre-ecteric periods? Please look. Are you copying? Continue. Incubation period lasting 7 to 50 days, usually 1. And pre-ecteric period lasting days or maybe 2 weeks, 5-7 days. Ecteric period, next period, lasts 1 to 3 weeks. And it is connected with severity of disease and age of patient. Because a younger patient has good regeneration process and ecteric period lasts time. And after developing convalescent period lasting 1 to 3 weeks. Doctors, clinical picture of viral hepatitis A and another etiology viral hepatitis common pre-ecteric period, ecteric period, and recovery. And by common clinical picture, what is organ affected? Jaundice, the liver, and characterized disturbance function of the liver, intoxication syndrome, and jaundice. And ecteric period, where validated first time, where presented lymphatic disease of the oral cavity, lymph and result implication after virus go to the bloodstream, repeat presentation to lymphatic tissue, the inflammation of the lymphatic tissue, and developing pre-ecteric period variant of flu-like variant. Result inflammation of lymphatic tissue of lymphophryngal vein. What is it here? Irritation. And patient feel pain over throat and appear nasal congestion and dry cough. And flu-like variant pre-ecteric period, chills, fever, pain of joints and muscle pain, and sore throat and nasal congestion. And dyspeptic. Disturbs function of hepatocytes and developing intoxication. What is dyspeptic? Nausea, vomiting, anorexia. Tightness in the mouth, heavy gastrum, and right hypochondria. And now, disturbs detoxification function of the liver, developing asthenization. What means asthenia? Sleeping, patient don't want walking, don't want studying, general malaise, dizziness, muscle pain, fatigue, headache, period. Maybe one variant developing, maybe combination. For example, dyspeptic plus flu-like, or for example, flu-like, dyspeptic, and asthenia. And after what is period developing after third period? And first signs of third period is this dark urine, change color of the urine, because disturb metabolism. And this maybe developing only dark urine, but it's a sign of jaundice, and our diagnosis must be ecteric period of disease. And first time appear dark urine after yielding the visible mucous membrane, right? And mucous membrane of throat, mucous membrane of the palate, head palate, and frenum of the tongue. And after appear yellowness of the skin, but first time appear yellowness of the face and continue body and upper and later loading. And after developing acalia of stool, It is a clinical picture of viral hepatitis, common clinical picture for all viral hepatitis, acute hepatitis. And doctors, on examination, you detected not only jaundice, increased liver size, maybe increased spleen size. Why? Because affected liver, yes, and increased liver size. The hemodynamics appear hypertonia, decreased, and bradycardia. Temperature is don't increase. Only in pre-icteric period, when developing flu-like variant of pre-icteric period, appear a subfebrile temperature. But fever is not rise to all viral hepatitis. Do you understand? And doctors, variants of pre-icteric period, please remember, flu-like, dyspeptic, and asthenia. And after pre-icteric period, we develop an icteric period, 10 to 20%. And our cases happened jaundice. And this time is not only cyclicose characterized for icteric forms. To anicteric forms is not for cyclic because absent cycles. Only patient had pre-icteric period. Do you understand? Continue. What is syndromes characterized by viral hepatitis A? Intoxication, icteric, jaundice, and mesenchymal inflammation. What is increased parenchymatose of liver and spleen? And doctors, jaundice, if your patient fat, you know it is fat depot through and this jaundice will be backed. Then, for example, urine level higher, but jaundice when you examine low. Why? Because fat it is depot, well alkalized bilirubin. Objective data is done 100% confirmed this station. Necessary biochemical test. From biochemical test, you understand what is level bilirubin and level transaminase activation, ILT and IST. And ILT and IST are the lytic syndrome, cytol of hepatitis. It is clinical picture. Have you questions? Online doctors? Okay.
No.
Okay. If absent questions, continue. Diagnosis. Doctors, plan examination. What is biochemical test and what to confirm what is etiology of disease. You must administer ELISA, detected antibodies against virus hepatitis A. Please look. It is clinical picture of hepatitis A virus, the scheme of disease. First time, before the clinical picture, incubation period, viremia, you know, virus from lymphatic tissue of small intestine go to the bloodstream, will be developing viremia. And after virus replicated in the hepatocyte, virus with bile go to the small intestine and virus in the feces. And after results cytolysis, hepatocytes developing clinical picture, and you detected high level transaminase activation. And with time you understand patient condition better. Yes? And ILT level higher, it is cytolysis, you have affected liver, and necessary examination to occurs viral hepatitis. And when you examine, you administer antibody virus hepatitis A immunoglobulin M. Immunoglobulin M, acute phase of a disease. Early antibodies. Later, specific antibodies, immunoglobulin plus G. But first time you detected antibody immunoglobulin M against virus hepatitis A, and you examined patient during 3 months. After 3 months, patient must be very good because decreased transaminase activation and to understand top cytolysis, don't affect the hepatocytes, and you may detected antibody immunoglobulin G against virus hepatitis A. But immunoglobulin stop acute process, stop replication, or decrease. Understand? And doctors plan elimination. From biochemical test, you understand affected hepatocyte, high level cytolysis, it is ILT and IST, characterize affected liver. But understand, it is acute viral hepatitis, but you don't know what is etiology. To understand what is etiology, helps to you ELISA examination. In the ELISA, you detected antibody half immunoglobulin M. But that antibody half immunoglobulin G, it is not viral hepatitis because acute phase. Patient has marked cytolysis, marked execution syndrome, high level transaminase activation, virus replicated, yes? But you absent immunoglobulin, present only immunoglobulin G, or it is maybe post-vaccination of infection immunity. You must eliminate it to another viral hepatitis. Understand? Continue. Sorry. Laboratory elimination. Doctors, biochemical test, hyperbilirubinemia may be present, may be absent, because ecteric or anecteric form. Activity of alanine aminotransferase and aspartate aminotransferase are increases, and test virus, it is ELISA, the blood serum antibody half immunoglobulin M and antibody half immunoglobulin G with M and plus G. If absent immunoglobulin M, it's not acute viral. But difficult case, you don't understand what viral hepatitis A or another, helps to you PCR, molecular biological test. You detected RNA, it's confirmed diagnosis viral hepatitis A. And additional examination, it is hemogram. Really mild, moderate cause characterized leukocytes. When a patient severe cause, decreased level leukocytes, and developing leukopenia, relative lymphomonocytosis, and delayed DSR. Absent specific change. Usually, relative lymphomonocytosis, what's the information? It is viral infection, yes? And developing increased neutrophils, you understand, it is activated bacterial infection. But viral hepatitis A, viral infection, leukocytes normal or with relative lymphomonocytosis. Copied? I have questions? Doctors, what do you understand? Please. Hemogram, its name, blood test. It's lymphocytosis, lymphomonocytosis.
This will happen. For example, when organ jaundice, you said
no, stop. Hemogram characterized only cells of the blood cells. It is erythrocytes, red cells, leukocytes, white cells, and thrombocytes. But biochemical tests characterize what is changed. Creatinine, urea included, and bilirubin and ILT and IST. is level 2. But the chemical test change of biochemical test common for all acute viral hepatitis and other etiology. You understand? Patient has acute viral hepatitis, but what is etiology? Sorry, you don't know. And confirm serologic body ELISA. ELISA, please question. No, and acute phase. And when virus replicated, developing acute process, you detected immunoglobulin class M. When discovered, what do you do? Please look. Immun M decrease, but increase in G. When you detected only immunoglobulin G absent immunoglobulin M, you understand this acute viral hepatitis. Biochemical test help to you, but another etiology because G has to post-vaccination and post-infection class. Usually it is acute phase, viral replicating. That's not question. No? Doctor, do you understand me? Okay. And from immunology now, first information to B cells, enough antigen in body. Synthesis maximum large antibodies class M is place large. Why? Because immune cells don't know the structure of this antigen. And after take information with a structure of virus and another agent and synthesis specific antibodies class G specific. And M disappear. But first response, M. Okay, continue. And diagnosis of hepatitis A virus. The hepatitis A diagnosis in a patient with suspected hepatitis is established when you detected antibody half globulin M. And for example, the case, you don't understand, yes, because on the antibody half globulin G and another markers negative, you administer PCR. When you detect it from PCR, RNA, virus hepatitis A in the blood, diagnosis, virus hepatitis A. Or for example, absent test system to ELISA, administer PCR, but analysis PCR rich than ELISA. Usually first time administer ELISA. It's PCR, it is additional examination, additional basic ELISA. Continue. And I said you, to viral hepatitis A characterized good prognosis. And please look, acute hepatic encephalopathy is complication connected with patient's life. Usually when developing this complication, maybe developing outcome death, and only 0.01%. And next complication, cholestasis. Doctors, tell me please, what's mean cholestasis? What do you think? Bile state, clinical picture cholestasis. If bile state, you understand, detected color of our skin of our is orange. And bilirubin, irritated nervous, and patient feel itching, and itching at night, usually prevalent. Patient irritated, don't good sleep at time, feel itching. But you only objective examination. But what is confirmed? Biochemical test. In a biochemical test, you detected high level bilirubin and 300, 600 and more, and markers as cholestasis, high level of alkaline phosphatase and gamma GT. And bile state, you know from microbiology course, bile is good medium for negative bacteria. If bile stay, activate this bile bacteria. And what is EPA? Inflammation, and it is inflammation, pressure to bile duct, and developing closed reinforcement. Bile don't may pass from bile duct, plus inflammation, pressure. What is ferropenicillin administered? Gram-negative bacteria. Antibiotics. But when activated gram-negative bacteria, what do we do temperature? Increase. When developing cholestasis, weighted secondary bacterial flora and its temperature. And dyskinesia, usually, what dyskinesia? Doctors, I said you, time to regeneration, it is 24 hours. Next day, appear new hepatitis. But from this new hepatitis, necessary bile architectonic of liver. But to developing architectonic of liver, necessary 6 months. After all viral acute hepatitis, we must be use diet and must be stop physical examination because increase pressure of abdomen and stops architectonic. But if you don't detect viral hepatitis, you patient anecteric cause, you don't diagnose, and patient don't use your recommendation. Stop physical examination and don't use diet number 5. What is it here? It stops architectonic. It is dyskinesia. Do you understand? Dyskinesia. It is disturbs architectonic. When from each hepatocyte must be bile built liver, but aortic. One this place, narrow this place. Disturbs architectonic. Yeah, the structure of bile tree. The structure of architectonic bile. The structure architectonic of the liver and developing dyskinesia. And recommendation, infected viral hepatitis A, during 3 months, stop physical examination. So who infected? Children, yes? And children from childhood, kindergarten and school, primary school. And stop physical examination. But if stop, say to children, mother, what do children with primary school? Play and run, yes, and stops architectonic. Architectonic. And doctors, for example, I said to you, breakthrough period, flu-like, yes? Patient had flu-like period. Don't develop injury. What is the diagnosis, doctor? Influenza or another viral infection. For example, child had dyspeptic variant of period. Nausea, vomiting. What do you think, mother? Maybe food poisoning, yes? Or maybe acute gastritis. And maybe a child answered to bad 3-5 days lasting disease, and after maybe mama don't go to the doctor, don't attend it, and don't with child examinated, and don't diagnose. And another, and it is false diagnosis will be food poisoning, influenza, for example, asthenia. Time result maybe play many multiple play. And but when dark urine, necessary attention, yes? But it is mama usually to doctor and necessary examined my child with change color of urine, yes. And necessary examined, but doctors, if doctor examined the child when patient child has, for example, only flu-like variant of preeclamptic period, and abdomen detected increased liver size, and its information necessary administer biochemical test. Preeclamptic period of disease, anecdotal cause of disease, patient has cytolysis. Only bilirubin level is not increased, but cytolysis is higher. But if don't attend it, examine it, because child has only flu-like variant, what is science of the throat, coughing, and examine it only nose and oral cavity, and don't examine abdomen. Don't examine, don't detect it increasing, and don't administer biochemical. And after developing this kidney disease, have you questions? Okay, continue. Outcomes of viral hepatitis A, its complications and outcomes. Total recovery, 99.9% recovery. Yes? And pro-drug convalescence. Transaminases are moderately elevated during 3-6 months. Asteno-vegetative syndrome manifested, but after 3-6 months, developing recovery. Don't develop chronization cause. Chronization characterized to viral hepatitis A. Recurrent cause. Why? Patient is from hospital, but repeat hospitalized because developed recovery. But it is reactivated replication virus hepatitis A. And post-hepatic hepatomegaly. Normal biochemical test. When you examine, liver size don't normalize, higher, increase. And extremely rare reduced level outcome. It's result developing acute hepatic encephalopathy. And doctor, please look at immune disorders. What play role trigger autoimmune mechanism? Who infected viral hepatitis A maybe after developing activated autoimmune process, maybe first time developing only autoimmune reaction, you detected autoimmune antibodies, but developing autoimmune diseases and registered younger woman after viral hepatitis A registered autoimmune viral hepatitis first time. And maybe developing rare cases but registered cryoglobulinemia, the appearance of a rheumatoid factor, hepatitis, and nephritis and cholera. It is autoimmune manifestations. And another tactic therapy, autoimmune diseases, what is therapy necessary administered? Immunosuppression. Yes? It's characterized usually autoimmune hepatitis first time to younger woman. And prevention. What prevention? Epidemiology service control canalization system, controlled central system, central water system. And sanitary measures provided where population with clean drinking water, early diagnosis of hepatitis A patients, and isolation these patients. Necessary examined, diagnosed. But it is not specific. It is epidemiological and sanitary measures. but specific it is vaccination. Vaccine administered one dose. This vaccine against vaccination is 1 month. Antibodies against viral hepatitis A, immunoglobulin G classes. It is antibodies persisted during 20 years and after necessary repeat vaccinated who live in endemic regions. Who don't in endemic regions may travel trip with another endemic regions recommended vaccination. But children who living in the endemic regions must be vaccinated. But country, total vaccination is recommended. Why? Because after disease, developing lifelong post-infection immunity. If in the childhood period, a child infected, what is cause of disease? Mild, yes, developing post-infection immunity. Will be older if viral hepatitis A, what is EPA? Severe cause of the disease, developing complications, and it's parents. What do you want? Want needed? Just yes, maybe don't vaccinate, but who must be vaccinated? Who have chronic viral hepatitis retro, B or C? Because human has chronic viral hepatitis B. Infected acute viral hepatitis A. Viral hepatitis play role trigger and decompensation chronic viral hepatitis B or C. But in unendemic countries, vaccination is don't 100% recommended, but necessary administered in endemic regions where 100,000 people, children living in areas with high incidence rate. And who must be vaccinated? Patients with chronic liver diseases, chronic viral hepatitis B and C, persons who risk of infected virus hepatitis A, first time it is drug users, men who have sex with men, persons traveling to endemic regions and countries, people with a coagulation factor disorder, and researchers working with virus hepatitis A scientists, and contact persons, hepatitis A host high antigen, to epidemiological indications after preliminary serological examination to hepatitis A. Copied and continue. And who have contact with ill person viral hepatitis A, for example, member of the family, must be during 1 month examined in ambulatory and sustained time per week clinical examination and biochemical examination, ILT and IST. You know, this appear later. And first time appear affected hepatocytes, yes, and sign of cytolysis hepatocyte, it is IST. And recommended immunization. Why? Because if you have the vaccination, when appear antibodies against a month, yes, and necessary administer immunoglobulin. This immunoglobulin persistent no later than 6 days after contact with ill person, antibodies persistent, and together you have the vaccination. First time prevention group play with passive immunization, immunoglobulin, and after developing post-vaccination immunity. And now, for example, 10, 20 years ago, in the world, vaccine effectiveness last 7 years, antibodies persist. Now, vaccine present when after vaccination, antibodies persist 20 years. 20 years. Administer one dose. Have you a question? Do you understand? Okay, doctors, time for a rest. How many times necessary for you? 10 or 15 minutes? 15. Okay, doctors, online students, after 15 minutes, return to my platform. Coffee break time.
Okay. Just a question, please.
Yes. Yeah. 10 minutes, please return.
Okay.
Okay. Presentation.
Yes, Professor.
Yes.
Who want copied last slide? This slide or another?
And I think it's slide number 26, the outcomes.
26, please. Outcomes.
Yeah.
Copy. Please copy. Just a minute. Are you copied? Doctor? Who
Yes.
wants slide number 26? Are you copied? Okay. Continue discuss. Next, viral hepatitis B. Doctors, from all viral hepatitis B registered in the world and registered 2 billion people infected viral hepatitis B. And in the world now, 7 billion people. Yes? And 1/3 part infected virus hepatitis B. It's actual problem in the World Health Organization. And please look what's mean viral hepatitis B. Hepatitis B is a viral entrepreneur's infectious disease with contact and vertical pathogen transmission mechanisms. It is characterized by the development of cyclically flowing parenchymal hepatitis with the presence or absence of jaundice. You know, jaundice when affected 2/3 part of the liver, which ends in most cases up to 90-95% with recovery, 5% developing chronization cause of the disease, as well as the possibility of developing chronic viral hepatitis B. And prognosis is not very good because 5% developing chronization cause result prolonged persistent virus hepatitis B, 2 decades and more, developing outcome cirrhosis and hepatocellular carcinoma, and complication registered 1%. It is acute hepatic encephalopathy. And situation in the world, please look. According to the World Health Organization, from 1 to 2 billion people with chronic hepatitis B infection are in the world. And doctors, what do you do? Where 5% infected persons with virus hepatitis B? China, and South Africa. Sub-Saharan Africa, no Republic Africa, no Sub-Saharan. 1-2 billion people die annually from hepatitis B and its complications. 1 million people every year outcome death. Up to 50 million patients with acute viral hepatitis B are registered annually in the world. By mechanism, what is parental transmission? And who is group risk? if a parental. No, adults, I understand adults, but drug addict persons from adults, drug addict persons, group risk. And epidemiology and public health burden face worldwide 250 million chronic H-based antigen carriers, and in 2013 year, 68,600 deaths from hepatitis B related liver disease and hepatocellular carcinoma. And please look where prevalent areas, more 8%, it is Africa, and 5-7%, that's African sub-Saharan, and China. This is this viral hepatitis B. In North Africa, don't register it as in other regions. And doctors, what is outcomes of viral hepatitis B? Please look. Intermediate incidence in the Russia Federation and low incidence in the North America and Western Europe. And please look, natural cause, human infected viral hepatitis B developing acute hepatitis and 95% developing recovery, 5% chronization cause of a disease. And after 20 or maybe 40 years, result a prolonged persistence, virus hepatitis B developing what is chronic viral hepatitis B persistence or active, and after developing cirrhosis, developing decompensation and outcome lethal, or maybe developing liver cancer where outcome death. And doctors, bad prognosis characterized to younger population, children. Why? Because poor immune response. Don't normalize immune response. Usually, nature way of infected viral hepatitis B, what is? A vertical from placenta, virus pass to newborn. And when newborn infected in the uteri, 90% newborns infected, and 90% have chronization course after, only 5-10% recovery. When age 1 to 5 years, recovery 70%, 30% chronization course. But after 5 years and more, outcomes as percent as adults. 5% chronization, 95% recovery. Then younger children with prognosis bad. Why? Because don't develop good immune response, necessary time for that. And doctors, please outcomes of acute viral hepatitis B. Human infected, asymptomatic form 65%. Asymptomatic. Human don't now infected, and it is source of infection because diagnosis don't diagnose. And acute hepatitis B 35%. From this acute viral hepatitis B 35%, 1% have permanent cause of disease where outcome will be death, and 5% chronization cause, and 94% recovery. But when develop asymptomatic form, developing chronic hepatitis B, result from persistent virus hepatitis B cirrhosis and hepatocellular carcinoma. And please look, result asymptomatic form, question, it's don't correct diagnosis, healthy carriers. What's mean? When you examine patient, you detected only H-based antigen. H-based antigen, it is a cover of virus, but you understand, virus absent replication, but virus present. For example, if you take your code and go to another building. I understand you present. What do you do now? I don't know. But you return and you must take this code because where is cool. And it is best antigen health carrier. It's not correct because virus present. And after replicated and developing colonization cause over disease. And result, prolonged persistent virus hepatitis B, developing hepatocellular carcinoma and cirrhosis. But what's healthy carrier? Patient don't examine, absent clinical picture. Patient don't know about this diagnosis, don't treat it. And after 20, 40 years, outcome lethal. And it is why actuality virus hepatitis B. And I said age features of hepatitis B virus outcome, 90% chronization cause, 10% recovery to newborn. And of age 1 to 5 years, doctor, what do you do during 2 hours? Time of our lecture, 8 half o'clock, now 10 half o'clock. Yeah. And 30% chronization cause, 30 or 40, and 60-70% recovery. Age 1 to 5 years children. And after 5 years, outcomes as adults. It is actuality of the disease. And why necessary, you understand, administer vaccination first days of life. You know, in all countries, World Health Organization program, vaccination, total vaccination. For example, in our country, 99.9% newborns vaccinated. It's program controlled our president. Because it's usually, how many? Please look, 20, 40 years, yes? You have chronization cause after 20 years, developing outcome cirrhosis. It is younger man, 20, 25 years, stop education, yes? Has now job, family, and outcome will be death. And doctors, you may be recommended transplantation liver. Oh, our medicine is very good, yes, in our century, but virus don't replicate it in the liver and characterize extra liver replication. All cells of the blood, mononuclear cells, and replicated in the lymphatic nodes, replicated in the bone marrow. And after transplantation, repeat liver infected and patient invalidization because necessary use immunosuppressor drugs plus antiviral drugs too. And for prevention necessary vaccinated first out of the life. Asymptomatic.
So, in both ways, like we go to chronic hepatitis.
No. Prognosis. Who infected acute viral hepatitis B? What's mean acute? It is immune response good because by developing clinical picture, immune cells detected with virus another, and developing cytolysis. Cytolysis of hepatocytes. T cells and natural killer affected virus, but together affected liver, where CT virus, and developing clinical picture. And adequate immune response and clinical picture. And prognosis only 5% after acute viral hepatitis B chronization cause. But what's mean asymptomatic? Virus is not detected as another because asymptomatic absent cytolysis. Virus is not affected. And what do virus? Persistent, persistent, persistent. And after developing what is colonization. Yes, it is situation and have administered to chronic viral hepatitis B patient administer antiviral drugs, but will be discussed after. Okay, it is connected with pathogenesis. Please look, asymptomatic form, absent healthy, absent recovery, asymptomatic, because immune response with virus is not detected as another. And okay, it's actuality. Your question is very correct. And please, etiology, doctors, virus hepatitis B, DNA. You know specific characteristic all DNA viruses, or do you do DNA viruses? Are you infected chickenpox in the childhood? Yes, but what do you do with virus chickenpox? It is third type of herpes viruses. What do you do? This virus leave you? Is this virus leave you? No, where is this virus? In the spinal ganglion, yes, and waiting. When we will be oldest, 80, 90 years, and after when developing nature immune suppression, this virus activated and developing what is clinical picture? Herpes zoster. And who is infected virus simple first type? Virus herpes labialis, herpes first type. Are you infected? No. But who is infected simplex virus first type? Herpes nasalis, herpes labialis. When after emotional problem, after exam, for example, yes, or for example, severe disease, influenza, this virus activated because DNA virus don't leave us and sitting, and virus hepatitis B DNA integrated in the host genome. And why developing colonization cause? Because integrated in the host genome. Don't leave. And DNA virus from the Hepatnaviridae family or the Hepatnavirus genus. Spherical particle with a diameter of 42 to 50 nanometer. The genome is represented by a partially double-stranded DNA molecule of an open ring form. And please look how many genotypes, 10 genotypes identified: A, B, C, D, E, F, G, H, I, and G. And patient may be infected one genotype and after next genotype. And doctors, please look structure of virus hepatitis B. If you know structure of hepatitis B, you understand pathogenesis and understand laboratory diagnostic viral hepatitis B. Please look. DNA virus has cover of virus superficial antigen HBs antigen. Another name in the literature you will detect it, Australian antigen, because this HBs antigen detected from Australian patients with chronic viral hepatitis B. But correct HBs antigen, superficial antigen. From this HBs antigen, this green points, virus presented to liver cells. If absent HBs antigen, virus don't may presentate and don't develop it infection process. This antigen, HBs antigen, necessary to presentation. And a nuclear capsid of virus, including DNA polymerase and two double-stranded DNA, where one strand full, this strand has 3,200 nucleotides. It's full, complete. It's named minor strand because don't necessarily plus new nucleotides. But please look, red line, it is incomplete second strand of DNA. It is defect, maybe 600 nucleotides absent, maybe 2,000 nucleotides absent, and its name is unfull strand plus, because necessary nucleotides to be complete. And it is but it is nucleotides with minus plus strand taken from host genome. Is the fact to complete take from host genome. And DNA polymerase polyfunctional enzyme. When virus replicated with DNA polymerase play a role. DNA polymerase and reverse transcriptase together, and RNA polymerase, and it integrates and help many functions. DNA polymerase, and if one DNA polymerase have many functions during replication virus, developing mistakes, developing mutations. Why mistakes? For example, tomorrow will be exam. You reading book together, talking with your friend, what's rules of exam, what is teachers good, is no is bad, where results will be bad, and together you want listen music, or for example watch TV. Are you listen information from friend, from book? Less. And developing mistake. It's mistake, polyfunctional for function of DNA polymerase, many functions, and developing every time mistakes, and developing mutations. Result mutation strain, and new strain, and with mutation strains absent antibodies after vaccination. For example, you vaccinated against a typical classical strain of viral hepatitis B. But against mutation strain, vaccine absent. Now you have problem with COVID-19. You vaccinated against virus who was registered 3-6 months ago, but against Omicron, you don't have antibodies. Yes, it's this virus, when virus mutated, this come back and repeat may be infected. Sorry, it's information about COVID-19 will be next semester, but doctors, now in the United States, registered humans who vaccinated against COVID-19, Pfizer, and infected because who ill maybe have antibodies, cross antibodies, but after vaccination absent. Against vaccination, effectiveness 99%. But vaccination against usually now rare registered mutated strains. Viruses don't very mutated. For example, HIV virus hepatitis C, every time mutated. Virus hepatitis B is don't rapid mutated, but mutated. And you must know who group risk may be infected mutated strain. Why? Necessary for you. You vaccinated, but in your clinical practice, you must be use all epidemiological measures because present mutated strain. You are vaccinated against typical classic. For example, many doctors think, I'm vaccinated, I don't be infected. No, maybe. Rare cases, but maybe. And doctors, at least look, structure. HBs antigen, it is cover of virus necessary for presentation. And nuclear capsid, it is a core antigen. It is in the nuclear, and present two types of HB core antigen in the nuclear, and next in the wall of hepatocyte present. And doctors, but in the bloodstream, you don't detect HB core antigen, because where HB core antigen? In the liver cell. After biopsy, you detect it, but who have intoxication syndrome, mastocytosis, you don't administer biopsy of the liver. No, it's not recommended. And why? Because developing only it is adverse events, developing only outcome death, maybe because developing bleeding. And doctors, but antigen don't detect it. Antibodies against HB core antigen, you detect it in the bloodstream, and it is laboratory examination. And HB core antigen, you don't detect it in the bloodstream, but scrub defect of HB core antigen, you detect it. It is HBe antigen, third antigen, HBs antigen, HB core antigen, and scrub of HB core antigen, HBe antigen. You know, virus replicated. Yes, if virus replicated, HB core antigen level high in the where? In the hepatocytes. But information high load HB core antigen, it is detected when you detected HBe antigen, scrub of HB core antigen. Do you understand me? HBe antigen, it is scrub of HB core antigen. And you don't may detect it HB core antigen, but if you detected HBe antigen, you understand virus replicated, active replicated. And HBe antigen has another B epitope than HB core antigen. And antibody synthesis against HB antigen specific. And antibody against HB core antigen, antibody HB core, antibodies against HBe antigen, name antibody HB, because scrub of HB core antigen has himself B epitope. It is structure of virus hepatitis B. And please look, genome of virus hepatitis B. GS answer to synthesis HBs antigen, but pre-S1 domain were developing mutations. And core answer to synthesis HB core antigen, but pre-core domain developing mutations. And pol answer to synthesis DNA polymerase enzyme, and two strand DNA minus strand, it is full and has 3,200 nucleotides, and defective strand plus defect may be 2,000 nucleotides, maybe 60 nucleotides, maybe 2,000 to 600. And this plus necessary building from host genome. It is structure of HBV genome. And please look, etiology, highly resistant in the environment. The infectivity of virus persists up to 3 months at room temperature. At a temperature from 4 to degree by centigrade, it is temperature of refrigerator, resistance continue up to 6 months. Temperature, yes. And temperature minus 20, 15, 20 years. And in dried blood plasma up to 25 years. Copy it? And what is condition inactivated virus? Hepatitis B virus is inactivated after chlorine at a temperature plus 180 degrees by centigrade for an hour, dry heat, plus 160 degrees by centigrade during an hour, boiling during 30 to 40 minutes, and chemical disinfectant as agents chlorine compound. Doctors, why I say to you this figures of temperature? I said you parenteral viral infection and result surgical operative measures and invasive examination, patient may be infected. But are you autoclaving your needles? Or for example, your medical instruments? No. What was developing after temperature 180, 160? Don't make walking. And only what is recommended, and boiling, no, 30 minutes boiling. Only chemical disinfectants and ultraviolet. Chemical disinfectants only recommended. And doctors, virus hepatitis B replicated don't only in the liver. Please look. Kidney cells, skin cells, exocrine gland cells, vascular endothelial, and blood cells, mononuclear blood cells, bone marrow, spleen, and lymph nodes. And doctors, it is the core of the virus. When virus replicated in the liver cells, when stop replication and repeat cell virus from lymph nodes, from bone marrow, go to the liver and continue the replication cycle. And you understand why transplantation is don't make 100% recovered outpatient. Copied and continue. Doctors, cycle of replication virus hepatitis B. From HBS antigen, virus presentated to hepatocytes because has common receptor with hepatocyte. Yes? And presented, and after go to the cytoplasm. In the cytoplasm, virus close DNA and developing covalently closed circular viral DNA. It is basic for replication virus. It is covalently closed circular viral DNA. In our name, you detected in the literature, scientist literature, cccDNA. cccDNA. It is cccDNA matrix to synthesize new DNAs. This cccDNA go to the nucleus of the hepatocyte and transcript activated to from DNA connected RNA, developing RNA pregenomic and RNA informative DNA and matrix DNA. And matrix RNA, it is matrix to synthesize DNA, and information RNA, it is matrix to synthesize proteins. And after in the ribosome, proteins and from endoplasmatic reticulum, virus covered, and after leave liver cell. But basic to replication, it is cccDNA. And now antiviral drugs are administered to stop against cccDNA. And when you neutralize cccDNA, stop replication virus. But doctors, you understand, virus is not 100% live human because plus thread DNA take nucleotides from host genome and integrate it in the host genome. It is cycle of replication virus. And epidemiology. Who is source of infection? You know, source of infection, only men. What is men? With acute and chronic viral hepatitis B. Absolute susceptibility of all population groups to hepatitis B virus. Hepatitis B virus DNA is found in all body fluids, blood, sperm, vaginal secretion, cervical secretion, breast milk, saliva, tears, breath, urine, feces, cerebrospinal fluid, and synovial fluid. Doctors, infectivity titer of virus 10 over 4 power. Infectivity titer. But concentration virus in the blood may be 10 to the 11th power. And to develop an infection process, 1 drop of blood necessary, only 1 drop. Because, you know, virus present in all human fluids, but high concentration in the blood and moderate concentration in the genital secrets. And why? First time it is transfusion, and next step it is sexual contact. Copied? Continue. And please look, concentration of hepatitis B virus in various body fluids. High blood, serum, and warm dischargeable. But moderate seed, liquid, vaginal discharge, and saliva. Low, but if low, present. Urine, feces, breast milk, tears, and sweat. Virus in the all human fluids. And mechanism, parenteral, but nature way, what is vertical and sexual, and artificial, what is, it is hemodialysis, it is hemotransfusion, it is injection. It is all investigations of human, invasive investigation. Copied? Let's look. Transmission ways, perinatal, sexual, it is nature, and contact and artificial parental manipulation, organ transplantation. And concentration of virus hepatitis B in blood reaches 10 over 8, 10 to the 11th power, but infectivity dose 10 over 4 power. 1 sexual contact without barrier contraception, human may be infected. And 1 injection of drugs, human infected. And infected mother, infected newborn from placenta. Why necessary all newborns vaccinated? It is actuality and epidemiology together. In your medical clinical practice, you must use all prevention measures, not only vaccination, and gloves together. Please?
For transmission ways, for hepatitis B, we can see, we can find the virus in spleen and actually in the a lot of organs in the body. So
no, when sweet, you must straps of the skin.
I know it's low
concentration.
But it's really any context on
Yes, because virus hepatitis B registered in the world. Why? From all viral hepatitis, parental viral hepatitis, high transmission. Don't only sexual contacts, 1 sexual contact. Infected human carrier, for example, if I saw the health carrier question, yes? present HBs antigen, maybe source of infection to sexual partner, but high risk infected who have necessary gloves.
Because also some causes.
Doctors, you must be vaccinated to stop to prevention only, because gloves and mask and maybe prevent it, maybe don't prevent it. Necessary vaccination, 100% prevention. We will be discuss prevention. Waiting for friends. But doctors, what is realization? For example, prenatal, you understand, it is from placenta, but at parental manipulations, not only in the medicine, it is but invasive examination, for example, what is gastroscopy and gynecology examination and operative measures, stomatology examination, and doctors who like go to the beauty salon, manicure, pedicure, tattooing, where if needles contaminated, it is source of infection. Don't recommend it every time. Go to the beauty salon every time, and must be only where every time examinated these salons. Skin from skin, yes. When cut skin and contaminated, infected, it's actuality. And I said you, one sexual contact without barrier prevention, human infection. And who is group risk? Who have multiple sexual contacts and who have multiple injections. It is drug addicted persons. And who group risk? Who have hemodialysis, kidney diseases patients, who have chemotransfusions, who have many operative measures. It is group risk. But to prevention principle quarantinization of the blood, to prevent infected from hemotransfusion. What's mean quarantinization? Are you now? I don't discuss in the microbiology course. Donor must be examined before you take blood. Examination to all parenteral viral infection. It is viral hepatitis B, C, HIV infection, and together you must administer a chemical test. Your donor is healthy, but incubation period of viral hepatitis B lasting 6 months, 1 month to 6 months. Maybe our donor this time is incubation period. Virus present because virus HBs antigen after weeks after infection. But it is incubation period. After you take this blood and keep in refrigerator. Don't administer to recipient. After 6 months, your donor return to you, and you repeat exam to this examination. Parenteral viral hepatitis B, C, HIV, Lewis, syphilis, and biochemical test. If disturbed, biochemical test, or for example, detected markers viral hepatitis B or HIV, you don't administer this blood to recipient. But who is donor usually? Our students and medical personnel, but you healthy, yes, maybe. But another, who take money, necessary money? Losers, drug addict persons, alcohol abuse persons. And it is group risk to infected parental viral hepatitis. And usually now in decrease risk chemotransfusions because present principle quarantinization of the blood. You take blood and don't administer to recipient this time. Necessary waiting 6 months. You understand me? Okay. If absent questions about epidemiology, continue pathogenesis. Doctors, virus from injection, from scrap of the skin, for example, usually of mucous membrane of genitals, go first time to bloodstream and go to the hepatocytes. And in the hepatocytes, replicated. You discussed viral hepatitis A. Virus replicated in the lymphatic tissues. This time, this case, virus go to the bloodstream, directly go to the bloodstream. And what is appear? Please look. Hepatitis B virus enters the bloodstream and invades hepatocytes. Virus replicated in hepatocytes, developing viremia, parenchymal diffusion of hepatitis B virus into various organs and tissue. And together, doctors, what is appear? Virus in the liver cell. And you know, HB core antigen, hydrophobe part of HB core antigen, where? On the wall of the hepatocytes. And T-cell lymphocytes take information. Another antigen on the wall of hepatocytes. And with complex molecules histocompatibility, class 1, with HB core antigen, its information to cytotoxic lymphocytes and toxic cytotoxic lymphocytes affected liver cells were present complex molecules histocompatibility with HB core antigen and developing what is cytolysis, but it is cytolysis is done indirect, because virus himself is not affected liver cell, and together natural killer affected virus and together affected hepatocyte, developing cytolysis. If developing cytolysis, what is appear? Intoxication syndrome, disturbed detoxification function of the liver. Together, B lymphocyte synthesis antibody, developing antibody-dependent cell cytolysis. And liver cells were present virus, what is affected, developing elimination, sanation virus, but together developing clinical picture. And please look in this scheme. Immune-mediated cytolysis of virus infected hepatocytes and developing antibody-dependent cell cytotoxicity, developing clinical picture of acute viral hepatitis and virus eliminated. But virus hepatitis B stands out with the surface of the glands together, and with glands virus eliminate. And when developing cytolysis, developing clinical picture. It is by developing acute viral hepatitis B. But you know, developing chronization cause. Why? Because virus is not only replicated and integrated in the host genome. It is total characteristic, common characteristic for all viruses, DNA virus. Please look, what do we do? Viral DNA integrated in the host DNA. And this virus, when defect is high, 2000 nucleotides, it is 2000 nucleotides from host DNA, and immune system don't detect it as another, because 1000 viruses, 2000 mine. I don't synthesize antibody against me. I don't synthesize cytotoxic lymphocytes against me. Yes? And what do you do? Absent clinical picture. Or maybe subclinical. And absent developing active immune response, active cytolysis. And virus, what do you do? Persistent. If persistent, developing chronization cause of a disease. When virus integrated in the host DNA stop replicated another antigens, only reproduce only H-base antigen, but HB core antigen don't reproduce. And you understand what means H-base antigen carrier healthy? No healthy. Virus integrated, only H-base antigen produced, but another antigen genes stop, stay. It's a situation. And together, what do? Stop apoptosis. Apoptosis is necessary for us. Why? Because what do apoptosis? Don't correct cells, atypical cells, apoptose, kill it. Yes? But these cells, atypical cells, don't eliminate it, what disappear? These atypical cells replicated and developing what is tumor. But when developing integration, stop apoptosis too. And developing chronization cause. But when developing chronization cause, first time absent clinical picture because absent a correct immune response. Stop immune response. Because only synthetic H-base antigen. But who is T cells, lymphocytes affected liver cells were present. What is HB core antigen? HB core antigen don't replicate it, don't represent it. Please, pathogenesis of chronic viral hepatitis B. Hepatitis B virus DNA integrates into hepatocyte chromosome as a provirus. The level of viremia decreases, stop replication. When prevalent integration, stop replication. A long-term persistent the virus in infected cells and expression only gene S. Another genes is not expressed and stop replicating. Suppression of apoptosis and oncogen distribution. And doctors result developing autoimmune reaction and autoimmune clinical picture. And doctors, together you understand if virus present on the extrahepatic cells, developing extrahepatic manifestations. When developing chronization cause, usually affected another organs, kidney, cells of skin, bone marrow. Do you understand me? And why 5% when don't absent good immune response and virus integrated? Heavy questions? If absent questions, please time to rest. What do? Lunch now, for example, 15 minutes rest, and after we continue clinical picture and laboratory test. Difficult part of next part of our third part of our lecture, it is laboratory test because laboratory examination connected with antigens of viral hepatitis B. And necessary rest for your brain.
HB virus will be 5.
Please look, doctors, stop talking, please. Doctors, discuss. Okay. Yeah.
By this way, from the polymerase, yes?
DNA polymerase.
Okay. All when the patient has this, the virus will be the DNA by this way, yes? When he finished the virus, the DNA will.
Why are you discuss therapy? No, therapy, yes, it's now drugs present against cccDNA in the nuclear and stop replication. If stop replication, don't affect you. Yes, but doctors, But doctor says DNA, what is integrated? You stop replication, but virus present. What is virus? Chickenpox, and maybe reactivated. And usually therapy administered don't only 3 months, 6 months, 5 years to maximum stop replication. While our aim, viruses don't disappear from human body, but stop replication. Our aim only stop replication. But when developing bad immune situation, immunosuppression, virus replicated because integrated. You don't take this virus from your chromosome. Yes, stop with replication.
Where is the virus from? It is not activated.
If stay with human is not maybe source of infection for another humans, but present in human body, in the human DNA, human chromosome. Only don't replicate it, stay sitting and waiting as opportunistic. Okay, I have how many times? 15? Okay, doctors, please, coffee break, 15 minutes. After 15 minutes, return, will be discussed clinical picture. Are you listening?
Yes.
Yes,
Okay.
Professor.
Okay, arrest. 15 minutes arrest.
Thank you.
Clinical picture of viral hepatitis, all etiology common because affected liver. And only a specific change characterized to how many times lasting each period. Incubation period lasting usually 2 to 6 months. And it's necessary now for you. For example, patient come to you and say, after your operative measures, I infected viral hepatitis B. When was operative measures? For example, 1 month ago to 6 months ago, yes, maybe in your clinic, patient infected. But when after 1 year, you understand, incubation period lasting only 6 months. It's necessary now. And for example, patient come to you after 1 week after extraction of a tooth. No, because incubation period 45 days, from 1 month to 6 months, minimum 1 month, maximum 6 months. If 1 week ago, 10 weeks ago, patient infected before come to you. And doctors prescribe period lasting 2 weeks and minimum 1 day or 1 week. Ecteric period lasting 2 to 4 weeks. And after developing convalescence period lasting 2 to 6 months, from 1/2 month to 6 months. And variants of pre-ecteric period. You understand? What do you think? Influenza period characterized to period of viral hepatitis B. Flu-like. No, because virus don't replicate it in the lymphatic tissue of oral cavity. Yes, and usually in flu-like influenza-like picture not characterized, but dyspeptic and astenovegetive characterized because they stop detoxification function of the liver. And together, a P-specific syndrome characterized to retroviral hepatitis B, C, and Delta. What is arthralgia? Arthralgic variant. What is appear? Pain in large joints and more stiffness of joints. Why? Because immune complex sit on the joints tissue. And exanthematose in our clinical picture as toxic allergic rash. Short-term urtical rash accompanied by skin itching. And it is a rash usually present 1 to 2 days. For example, yesterday appear rash, now patient come to you, rash disappear. Maybe 24, 48 hours with rash present after disappear. It's characteristic of exanthematose variant. And it is a result where immune complex sit on the wall of the vessels, developing toxic allergic pressure. And after, please look clinical picture. What is appear after pre-ecteric period? Appear ecteric period. And first sign of ecteric period, it is jaundice. Or what is pre-ecteric period? What is dark urine. Before appear jaundice, it is dark urine. And please look clinical signs of symptoms of acute viral hepatitis B. Intoxication, result disturbs function of the liver. Ecteric affected 70% of liver cells. Mesenchymal inflammation, increased liver size, and hemorrhagic. Why appear hemorrhagic? Characterized to severe course of the disease, because function of the liver, it is detoxification, and next function, what is protein synthetic and synthetic factors of the coagulation. And disturbs coagulation when affected deeper structure of hepatocytes and developing hemorrhagic syndrome. Hemorrhagic syndrome characterized to severe cause of all viral hepatitis. And swollen ascites. Why developing ascites? It is result drop protein. Without protein, edema, dermatose ascitic syndrome. It is, you understand, it is characterized to severe cause of viral hepatitis when developing swollen ascites. Okay, clinical picture, I said, it's common for all viral hepatitis. You discuss discuss viral hepatitis A. Next, laboratory examination. Patient has intoxication syndrome. Patient has jaundice, and doctors, first time appear pre-ecteric period, and later appear ecteric period. Together, two syndromes don't appear. First time appear intoxication syndrome. And you administer laboratory test. You administer biochemical test. What do you detect with biochemical test? High level ILT and IST and high level bilirubin. But it is change characterized for all viral hepatitis. You only understand it is acute viral hepatitis because we'll be discussing yersiniosis, developing bacterial hepatitis, yersiniotic hepatitis. Another figure of the enzymes. But to acute viral hepatitis characterized high level ILT and IST 1,000, no 30, but 1,000 and more characterized max cytolysis. 100 it's cytolysis, but it's not very high. And to confirm diagnosis, you must detect specific markers characterized to viral hepatitis B. Please look at serological profile of viral hepatitis B. HBs antigen. What means HBs antigen? It is cover of virus, superficial antigen. And this antigen appear on the after 2 weeks of when patient infected. Without clinical picture, it is early stage of incubation period, and you detected HBs antigen. And it is examination good when you examined contact persons who have contact with ill person, and for example, parental contact with persons. And when developing clinical picture, appear intoxication syndrome, and with time you detected not only high-level HBs antigen, and together you detected antibody against HB core antigen, immunoglobulin, what is class? M, acute phase. Doctors, usually two markers confirm diagnosis. HBs antigen, it is cover of virus, and antibody against HB core antigen, immunoglobulin class M. Core antigen absent in the blood because in the hepatocytes, on the wall of hepatocytes, yes. But antibodies you detect. It's 100% confirmed diagnosis. Combination HBs antigen plus antibody HB core immunoglobulin M. It is basic markers to confirm diagnosis. Together, you may detect it HBe antigen. What's mean HBe antigen? I said you.
Active replication.
Yes, very good. It's scrap, yes, of HB core antigen. And you understand when HBe antigen present, high level HB core antigen in the hepatocytes characterized and high level replication. HBe antigen, you may detect it, you maybe don't detect it. It is connect with replication virus. And it is Mercurius acute phase, moment replication. Together, additional examination, PCR. You detected high load PCR from PCR HBV DNA. For example, 1 million copy HBV DNA. But it is additional because to chronic viral hepatitis B, to acute viral hepatitis B, you detected DNA HBV. But confirm acute phase markers, I repeat for you, HBs antigen plus antibody HB core immunoglobulin M. After developing recovery, stop replication of virus. And HBe antigen, you don't detect it, but you detected antibody against HBe antigen. Antibody, it is good prognostic marker because replication stopped. And early recovery period where you detected antibody HB. It is prognostic good marker. And after 5-6 months, please look, absent antigens, you detected only antibody HB core total, another immunoglobulin class G, immunoglobulin class M decrease, and appear antibody against HBs antigen. Doctors, marker post-infection immunity. This immunity lasting lifelong. It is through antibodies. And when developing recovery, human body is unaided, you don't detect antigens, not replication virus. You detected only antibody. What is antibody HB core immunoglobulin G plus antibody HBs. Post-infection immunity, lasting lifelong. Do you understand? But you must examine ambulatory patient during 6 months. After 6 months, you know what will be prognosed, good or satisfactory. Good recovery and 5% developing chronization course. Usually 95% will be antibody HBs and anti-HB core immunoglobulin G. Post-infection immunity. Do you understand? Okay, continue. Chronization course. You examine patient after discharge from hospital, and after 6 months you detected, after stop a clinical picture, HBs antigen was and continue to detect HBs antigen. And you understand, virus present, don't disappear. And together you detected antibody HB core immunoglobulin G, or another name total. Why? Because I said you immunoglobulin M is non-specific. It is early onset immune response. Yes, and it senses maximum large antibody. And later, when take information what the structure of virus, synthesis specific antibodies plus G. And doctors markers chronic viral hepatitis B, HBs antigen plus antibody HB core immunoglobulin G. And you may be detected HBe antigen. HBe antigen, it is scrap of HB core antigen, characterized high level replication. But usually when developing chronization course, you know, virus is not replicated, yes? And usually you detected antibody HBe. And when you detected HBe antigen, it is a chronic viral hepatitis B active phase, chronic active viral hepatitis. When you detected antibody, chronic persistent viral hepatitis B, prevalent chronic persistent viral hepatitis. And it is a situation lasting lifelong because virus don't disappear, only stop replication. You understand? When you detected HBe antigen, when patient has chronic viral hepatitis B and HBe antigen, you detected it is chronic active viral hepatitis B, virus replicated. When virus is not replicated, you detected antibody HBe, prevalent undetected antibody HBe, chronic persistent viral hepatitis B. Active, it's replicated. And another name, chronic viral hepatitis B, HBe antigen positive, HBe antigen negative. Do you understand? Online doctors, are you understand? Online.
Yes.
Yes, doctor.
Sleeping? Are you sleeping?
No.
Yes.
No.
Okay, and repeat, continue with information. HBs antigen, it is early antigen, appear after day 20 from the moment of infection in the blood serum. And antibody HB core immunoglobulin M appear at the end of incubation period and disappear during the convalescence period. Antibody HB core immunoglobulin G is detected during early convalescence and persists during life. And HB antigen is marker of active replication virus hepatitis B. Antibody HBe indicates about decrease of viral replication activity. And antibody HBs appear on the 5-6 months after onset of the disease and characterize post-infection immunity and post-vaccination too. And additional laboratory examination, it is PCR. You detected HBV DNA. But doctors, what is process? Active, chronic, you don't know when you have only information about HBV DNA, because HBV DNA replicated when patient has chronic cause and acute cause too. Only you know patient infected viral hepatitis B, but what is process you don't know. Help to you. Data of examination, biochemical test characterize acute process, and markers acute viral hepatitis B or chronic viral. Do you understand? Okay, continue.
I have a question.
Please, what is Kazi?
What was the markers, please? Can you say again?
What is markers, acute or chronic?
Acute phase.
Oh, continue. Sorry. Doctors, markers acute viral hepatitis B, HBs antigen, it is cover of virus, and antibody HB core immunoglobulin M. It's marker acute viral hepatitis B. Together, you may be detected HB antigen if virus active replicated. You may be detected, maybe not detected, but basic markers to confirm diagnosis: HBs antigen and antibody HB core immunoglobulin M. When developing early recovery, HB antigen you don't detect it, you detected antibody against HB antigen. And after 5-6 months, you don't detect it, antigens, you detected only antibodies. It is antibody HB core immunoglobulin G plus antibody HBs. Antibody HBs appear on the 5-6 months after onset of the disease.
Okay.
Are you understand?
Yes.
Okay. And complications: 1% acute hepatic encephalopathy. What's mean acute hepatic encephalopathy. It is hyperactive immune response or total liver cells affected and absent time to regeneration new hepatocytes and developing necrosis of the liver. If developing necrosis, disturb function of the liver, what is not only protein detoxification and protein synthetic, developing what is hemorrhagic syndrome, and outcome will be death. And next complication, cholestasis, why developing cholestasis, and autoimmune hepatitis first type. Why? Because immune complex persistent and developing autoimmune diseases. Acute viral hepatitis will trigger autoimmune immune disturbs and developing autoimmune reaction and autoimmune diseases. And please look, outcomes, acute viral hepatitis B, 90% recovery, 5% chronization cost of the disease, and 1% lethal outcome connected with acute hepatic encephalopathy. And result many times persistent virus hepatitis B, developing hepatocellular carcinoma and cirrhosis of the liver. And doctors, what is principle of the prevention? What do you think? What is vaccination? That's very good. Yes, vaccination. And epidemic measures in force of infection, testing blood donors to hepatitis B virus and blood quarantinization. How many lasting quarantine? How many time lasting incubation period of viral hepatitis B? 6 months, maximum 6 months. Yes. Examination of pregnant women to the presence of HBs antigen. Compliance with rules of processing medical instruments. Compliance of the rules to work by medical staff. Use of gloves, masks, goggles. All must be used, all sanitary measures, epidemiological measures, and public health education with people. But it is done specific prevention measures, and specific it is vaccination. And doctors, tell me please, three basic antigen, HBs antigen, HB4 antigen, and HB antigen. What is antigen? You must be neutralized. What is HB antigen? Necessary neutralized.
HBE.
Very good. Because from HBs antigen, virus presented to liver cells and necessary neutralized HBs antigen. If HBs antigen absent, virus don't affect hepatocytes and nerve cells. And what do? If you administer live attenuated vaccine, you infected human and developing chronization cost of the disease. And necessary administer HBs antigen like particle. Because recombinant synthesis HBs antigen absent without nuclear, without DNA. If present DNA, what do? Integrate it in the host genome and develop a clinical picture. And our aim only necessary neutralized HBs antigen and administer HBs antigen like particle, recombinant. It may be enzyme structure as structure of HBs antigen virus. And administer. But doctors, are you vaccinated? How many times are you vaccinated? How many doses are you vaccinated? One? No one. 3 doses. 0.
3 doses.
First dose 0 now. After 1 month, second dose, and after 6 months from first dose, it is third dose. Why? Necessary administer time. When you administer first dose, activated B lymphocytes, B lymphocytes synthesis antibody from course immunology, And after 1 month, you repeat administer this dose of HBs antigen and activated memory cells. and memory cells activate. And when you administer the third dose, 6 months, it is necessary keep this information in the memory cells. And tell me please, when synthesis antibodies titer effectiveness titers antibodies, you administer H-based antigen like particle, yes? But how many time necessary for developing post-vaccination immunity? How many time necessary to synthesize antibodies against H-based antigen? Our aim, activated immune cells, B lymphocytes and memory cells to synthesize antibodies against H-based antigen. When you, okay. Please look. When synthesis antibody H-based when patient infected viral hepatitis B, virus hepatitis B. What I say? After 5-6 months, yes? And doctors, and vaccination will be effective on the 6 months after third dose, on the time when you administer third dose. It's connected with nature history of viral hepatitis B. And doctors, for example, your patient come to you and say, doctor, your vaccine is not effective. You vaccinated me, but I infected viral hepatitis B. When vaccination will be effective? After half year, after 5-6 months. And maybe patient say to you, doctor, you infected me. Your vaccine infected me. Are you infected? No, because it is not virus. You don't administer virus. You administer only H-based antigen-like particle, recombinant. You don't infect it. Absent genetic material, absent DNA in this vaccine. You administer only H-based antigen-like, cover-like particle. And vaccine will be effective on the 5-6 months after the vaccination. Please look.
And before 6 months for the vaccination dosage, the patient he take, for example, 1 or 2 doses.
But patient must use all 3 doses. If patient less 1 dose, for example, second or third, vaccination is not effective. You must repeat administer 3 doses. Scheme. Yes. For example, patient use only first dose, but don't come to you to using second dose. And repeat go to you and say, doctor, please give me third dose. No. Second dose absent. You must repeat administer 0, 1, this is first dose, second dose, and third dose. Effectiveness will be when you administer 3 doses.
But before the third dose, it's effective.
Yes, it's effective. No, this vaccination is not effective. It's connected with immune response, but doctors will be clinical picture because when you administer first dose, don't synthesize antibodies. When you synthesize antibodies after 6 months, but in full dose is necessary to administer. Effectiveness absent, and vaccination is carried out according to the scheme 0, 1 month, and 6 months. And revaccination after 5-7 years, because after 5-7 years, patient less of antibody, and you must repeat vaccinate. And emergency vaccination is carried out no later than 72 hours after contact according to the scheme 0, 1 month, 2nd month, and 12 months. And usually, who is emergency vaccinated? Medical personnel, prevalent medical personnel, 72 hours. For example, social person don't know. When infected partner, social person understand social partner. But in the problems in the medical clinic, for example, stomatology doctors, surgery doctors have contact with scrub of skin, yes, and necessary this time, during 72 hours, vaccinated. But before go to the job, you must be vaccinated. It is principle prevention. Have you questions? Absent questions? If absent questions, time to rest 30 minutes. Lunch and doctors. But my recommendation, you now understand markers, viral hepatitis B. It's difficult. Tonight, please, during 5-10 minutes, read this information. Because Friday, we must discuss these markers. It's necessary to understand next viral hepatitis Delta.
How many between antibodies against HPS from natural infection versus vaccination? How do they tell the difference?
Doctors, difference. When you administer H-bias antigen, it is only antibody against H-bias antigen. It is post-vaccination immunity. If patient infected, patient take for all antigens. And patient has antibody HBs and antibody HB core immunoglobulin G. Difference. Post-vaccination immunity and post-infection immunity. If you administer only H-bias antigen, it is only antibodies. If patient take infected virus, antibodies against HB core antigen. Okay, doctors, online students, please, after 40 minutes, return to my platform, group number 64. Are you listening?
Yes.
Yes.
And now students, group number 72 and 66, go to your teacher's platform.
Okay,
Right.
Return to my platform. Okay. After 40 minutes, I am waiting you. Time to lunch 40 minutes.
Okay, thank you, Professor.